Sure. I'm Mark Richardson, PhD in biology. My company is Risklogic Scientific, though I've worked for Health Canada, amongst other companies and departments. All of this kind of started in 1994-95. I was asked by Health Canada to do a risk assessment of dental amalgam. And I said, well, why is that? Well, because you've just finished your PhD studying mercury. And I said, well, what's mercury got to do with dental amalgam? And that's when I learned in 1994 that dental amalgam is about 50% mercury by weight. Had never known it. Kind of surprised by it. But anyways, that's what led to all of my work on dental materials. So I had just finished all the work for the FDA, looking at the US population, when Statistics Canada made publicly available a new database that had been collected. It was a population representative sampling of the Canadian population, in which they had dentists count the exact number of filled amalgam surfaces in all the participants' mouths. And it's the first population-based survey anywhere that made an accurate count of the number of amalgam fillings. The work I'd done for the FDA, they had very good data on the number of dental restorations in people's mouths, but they didn't say it was dental amalgam or ceramic or gold or composite. They just said it's restored. So we were able to, based on some other information, figure out how many of those restorations would have been amalgam. Well, for Canada, we didn't have to do any of that figuring out because they'd actually recorded the exact number of amalgam fillings in everybody's mouth. So we were able to take that information. They also collected urine samples from most of the people who were surveyed and measured mercury in their urine. So we could link the number of amalgam surfaces directly to the urine mercury concentration. And through those relationships, do an extremely accurate, probably the most accurate estimate of mercury exposure from dental amalgam that's been done to date. And that was completed, about 6 months ago. I guess it was in September of 2012. I submitted that to a journal for publication. It's been accepted, and I'm waiting for it to come out in print. So we have an update of the Canadian risk assessment for dental amalgam that's specific to the years 2007 to 2009, because that's when Statistics Canada conducted their survey of the Canadian population for that particular study. So that sort of allowed me to update that study. Hasn't changed the picture very much. The levels of exposure that I'd predicted in 94, 95 match pretty closely with what we concluded for the US, and it matches very closely with what came out of this most recent study, the most accurate study. So it I was quite pleased that the efforts done, in 94 and 95 were pretty accurate. Like, there is not a lot of error introduced by uncertainties in the process that was used then. We were pretty much bang on for the amount of mercury you get per amalgam filling and that sort of thing. So that is due to come out in the journal Human and Ecological Risk Assessment, hopefully within the next 3 to 4 months. And that's the journal where I published my first study for Health Canada. Back in 96 is when they published that. So I went back to the same journal just to be able to provide that continuity and the update within the same journal that published the original work. So, and again, like we have about 1/10 of the US population. You have 300 million or so. We've got 30 to 33 million citizens. And it looks like the exposures are just about the same as in the US, just factored down by 10. So it's about a factor of 10 lower, which is really what you'd expect, because we have similar standards of dental care. We have countries that maintain their policies on dental amalgam safety for use as a dental material. So our countries are very similar in terms of the amount of dental amalgam that's still being used. It is interesting that over the last decade, both the US and Canada report about a 50% reduction in the use of dental amalgam, which is, as far as I'm concerned, a good news part of the story. This sort of debate, if you want to call it, going on about the safety of dental amalgam. It's been going on for a long, long time. As I said, I got involved in 94 and 95. I wouldn't say that we've ever won a major argument or anything with the government about, trying to take some action, some positive action to reduce the use of dental amalgam, but we've managed to affect the same thing through increased knowledge, the increased availability of aesthetic or white filling materials and that sort of thing certainly is added to the effect. But really, I like to think we're winning the war. That dental amalgam use has dropped off by 50%, and it drops about 5 to 6% every year. It's just going to do that constant decline, I'm sure, until there'll be some base level of use still in the population in 10 years' time. But I have a feeling that its use will all but, pretty much disappear for most applications, which is good. It's going to happen in my lifetime, which is kind of nice.